So next is Dr. Alieta Eck. She is an internist and former president of the American Association of Physicians and Surgeons, AAPS, referred to by Dr. Tierstein earlier. Dr. Eck graduated from Rutgers College of Pharmacy and the St. Louis University School of Medicine in St. Louis, Missouri. She studied internal medicine at Robert Wood Johnson University Hospital in New Brunswick, New Jersey, and has been in private practice with her husband, Dr. John Eck, MD, in Piscataway, New Jersey since 1988. She's been involved in healthcare reform since residency and is convinced that the government is a poor provider of medical care. She testified before the Joint Economic Committee of the U.S. Congress in 2004 about better ways to deliver medical care in the United States. In 2003, Dr. Eck and her husband founded the Zarephath Health Center, a non-government free clinic for the poor and underinsured that currently care for 300 to 400 patients per month, utilizing the donated services of volunteer physicians and surgeons. Physicians and nurses, correction. Dr. Eck was the 2012 president of the Association of American Physicians and Surgeons and serves on the board of Christian Care MediShare, a faith-based medical cost-sharing ministry. She is a member of the Zarephath Christian Church. Dr. Eck was the Republican nominee for the U.S. Congress for New Jersey, District 12 in 2004. The topic of her presentation is How to Cure Bureaucracy.
I'm a physician in private practice, and I also, with my husband, run a non-government free clinic 10 miles away in central New Jersey. What I want to do is explain to you what I have observed in the past 30 years of being a physician, what the problems are that we see, and how we can fix them. When I went to medical school, I wanted to be like Marcus Welby. Marcus Welby was a TV physician played by Robert Young, who everybody loved, and he would see people in their office. He would go to the hospital to see them when they were sick. He was there when they were born. He was at the funerals. I mean, he just really knew and loved his patients, and they loved him. And I wanted to have that kind of relationship with patients when I went to medical school. That's what I pictured. Well, since then, our medical system has turned into something very, very different. It's gotten more expensive, and it's gotten far more bureaucratic. Administration is a good thing. It's what we do when we take all the different parts of a company or a hospital, put them together, and make it work well. Bureaucracy is something that's different, and that is administration characterized by excessive red tape and mindless routine. Here's an example. I have this little urinalysis machine in my office, and you take a strip and you dip it in the urine, you stick it in the machine, you push a button, and out comes the results. Simple as that. Well, a lab inspector from the state came and wanted to know who's running this machine, and she wanted to make sure they all had high school diplomas. Well, we had RN degrees, we had MD degrees. That didn't suffice. She wanted to see high school diplomas. That's an example of mindless bureaucracy. I did some research. I found Milton Friedman is an economist. He was an economist, very excellent economist, who was looking at the whole idea of bureaucracy and came up with a fellow by the name of Dr. Max Gammon from England. He was a physician, examined the national health system, which has been in existence since 1948, with socialized medicine, and he talks about the progressive displacement of productive activity by non-productive and often counterproductive bureaucratic activity. He noticed that the healthcare system was costing more and there was less output because people were on long waiting lists, and he came up with Gammon's law of bureaucratic displacement. The National Health Service, hospital beds in 1948 were 480,000, went down to 186,000 by the year 2000, and employees went from 350,000 up to 882,000 in the same time. Milton Friedman says such systems act like black holes in the economic universe, simultaneously sucking in resources and shrinking in terms of emitted production. Sure enough, in our healthcare system we have more and more paperwork, and medical students are finding they have less interaction with patients because they're busy with that computer all the time. You might see that in your doctor's office. The doctors have to input so much information in order to get paid by the bureaucratic system that would really rather pay them less. And when you think of somebody going to medical school, do you think of them learning how to observe patients and talk to them and examine them and determine how to best care for them? Or do you think of them playing doctors and nurses and talking about all these algorithms and everything that needs to go into the medical record? This is a slide that I think is extremely telling in the United States healthcare system. The little line on the bottom is the growth of physicians. It doubled since 1970 to 2009. But administrators in the healthcare system have gone up by 3,000%. 30-fold increase in the number of administrators in the healthcare system. And here is our new healthcare system, which we have under the Affordable Care Act. Physicians are on the bottom left-hand corner, and you've got the patients on the bottom right-hand corner, and all that bureaucracy is in between. Is there any reason why you can't understand why the healthcare system costs so much? Who are these people in the healthcare bureaucracy? All these jobs are legitimate jobs, but I'm just saying, when you put them all together and you pay them all, are we really getting better health care? Documentation specialists speak to us in the hospital and they tell us what to write, things to put in the healthcare record to get to the hospital to be paid more. If somebody has a simple urinary tract infection, they don't get much more money in the hospital. But if we can say that they've got a fever or they have bacteremia or something else, we write those buzzwords in the medical record, then the hospital gets $3,000 more. Have they spent $3,000 more in the care of the patient? No. But they've learned that these certain words are what get them more money. Those are the kind of things we're plagued with in the hospital. They're chasing us down. Then there's the Independent Payment Advisory Board. There's the alternate payment models for physicians, the Sustained Global Rationing Program, Physician Quality Assessment, all of these things that are just adding to the bureaucracy of our healthcare system. Okay, how good is your doctor? When a patient is looking for a doctor, he wants somebody who's available when I need him. Does he listen to me? Can he make the correct diagnosis? Does he know how to treat what I have? Does he care about me? Isn't that how you value your physician? How does a bureaucrat value a physician? They have this merit-based incentive plan. They don't want to pay us for visits. They want to pay us for the outcome. So if I see a patient 4 times a year for diabetes and I go through what they're eating and how much exercise and what medicines they're taking, that's one thing. But they want to say, well, no, how is their sugar controlled? And if it's not well controlled, somehow that's my fault, even though I am not with them the 300 other days a year. That is just a way a bureaucrat thinks. Physician quality assessment, all of that stuff, meaningful use, medical records, that's what they want us to fill in 17 boxes in a doctor visit. And maintenance and certification, these things that are just plaguing us on how we treat patients. A good physician, according to a bureaucrat, is someone who earns less and he spends less on patients so the bureaucrats can earn more. Another thing that's going to happen in our healthcare system is the loss of privacy that we have. And if everything you say to a doctor is going to wind up going online and somebody else can read it, you're going to be very careful what you say. And often there are very private things that you need to tell your doctor if you're to get the proper care. And that's why Hippocrates in 400 BC said, I will respect the secrets that are confided in me. It's extremely important that patient privacy exists. That's being lost in our current system. And then there's the cost of healthcare. Thomas Sowell has said it best. It's amazing that people who think we cannot afford to pay for doctors, hospitals, and medication somehow think we can afford to pay for doctors, hospital, medication, and a government bureaucracy to administer it. So what should we do? We need to limit the bureaucracy in our healthcare system, somehow figure out how to pare it down. And here's something I think ought to make you very angry. If you're a 30-year-old and you're working as, say, a waitress, and maybe you have a couple jobs, you might be a single mother, you're going to be asked to spend $268 a month on your health care, which is a lot of money to begin with. But if you then have a medical problem and you've gotten the bronze plan of the Affordable Care Act, you're going to need to spend $6,000 before you can access any of that health care in your insurance policy. That's a huge amount. Partly of what you're paying for is the huge bureaucracy, because actuaries tell us that if you eliminate all that and you simply had a $6,000 deductible health insurance policy, it should only cost about $50 a month. So you're paying $250 for nothing. The higher the deductible, the lower the premium, and I think that for sake of argument, if you're paying, say, $1,000 a month for a family, if you had instead put $500 a month away in a health savings account and $500 away into a high deductible health insurance policy, that first $500 would be money you could access to spend on current health care expenses. That's a more reasonable, logical way of paying for our health care. Then what about people who can't afford anything? And of course, that's what we were told. That's why we needed to have this whole new big government program to pay for those people. Well, we started a non-government free clinic in central New Jersey for the poor and uninsured 10 years ago, and I've learned a tremendous amount of what the people are going through and how we can help them. And in this clinic, we found that we can care for people at a cost of only $13 a patient visit. The reason we can do that is because everybody volunteers. And to me, that's what charity is. You're caring for people who can't pay. The state of New Jersey is spending $13 billion on the Medicaid system, which is so bureaucratic and so laden with paperwork that doctors don't take it. So people can't even find a physician in the Medicaid system. And yet it's going to be 1 in 4 New Jerseyans that are going to be on Medicaid once the Affordable Care Act allows them all in. Every state's the same way. It's about 1/3 of the average state budget is being spent on Medicaid. A very, very highly bureaucratic program that really is not working. If the cost to provide care in a non-government free clinic is only $13 a patient visit, we need lots of these clinics. And we need lots and lots of doctors to volunteer to care for those who can't care for themselves. The state of New Jersey, we have a bill that's pending to be heard before the Health Committee in which doctors would donate 4 hours a week in a non-government free clinic. When I say non-government, I'm saying it's because we don't want to have the taxpayers funding a whole lot of bureaucracy. Lots of volunteers will help. About 10,000 people are retiring every day in this country. So these are people who might be willing to put in a day, a month or so to really make a difference in their community. And in our clinic, we have the health care, and then we have food and clothing for people who have really fallen onto hard times. I have tremendous, wonderful stories of people who we've helped, who then have been pulled up and are able to now get on with their lives because we pulled them through a hard time. So this law, doctors would donate 4 hours a week, and all we're asking the state to do is give us malpractice protection in our private practices. Already the federal government protects us for what we're doing in the free clinic. So now just extend that to the doctor's private practice. And every doctor I know that speaks to this, I would do that. And now we'd be working all together and solving the problems of the poor without fleecing the taxpayers is what's currently happening. The 3 aspects to common sense healthcare reform would be the health savings accounts where people just pay directly for the routine. There are actually some doctors who are now doing practices where you give $50 a month, like a membership, and you're available by email, by Facebook, by telephone, or you come in for $50 a month. That's like a gym membership. It's less than a gym membership. It's you directly with the doctor with no bureaucracy. Catastrophic insurance then should be high deductible like it is with their homeowner's insurance. They don't pay for leaky faucets, they just pay for big things. And finally, real non-government charity where the doctors donate their time. With those 3, we will minimize bureaucracy, we'll bring accessibility to healthcare, affordability to healthcare, and we'll keep the high quality that we're accustomed to. That would be my solution, and actually a lot of us are coming along the same way. A common sense healthcare reform that we really need. Thank you.
Hey, Alieta, Judy Thompson here. Can you hear me?
Hi.
Hey, welcome.
Thank you.
Thank you.
Great program you're putting on.
Thank you. Nice to hear from you, Alieta. Mike.
Thanks.
Well, thank you for your presentation, and will you update us on what's happening with the bill that you had put forth in New Jersey that you talked about in your TED Talk?
Sure. We're working hard to get it just to be heard by the Health Committee. There is one senator who happens to be the head of the committee who is blocking it. And if you know anything about the way lobbyists work, that seems to be the way things get done and how much money is put in. There's not a lot of money in charity. So that's what's holding it up. However, because the the state budget can't handle what we're now doing. Eventually it's going to be a breaking point. And we've been hammering away at these legislators for the past 2 years. I honestly think it's going to finally get brought forth. And once it is, this law is going to pass.
Okay. Dan, Michael?
So yeah, we're looking forward to it.
Oh, go ahead. I'm just answering a comment here.
I have another question for you, Alieta. A prevailing question for this summit, leading up to it and during the summit, is we're soliciting individuals' thoughts on engaging physicians. And one of the things I'd like to do in a roundtable that we're going to have later on this afternoon is give physicians ideas for actionable items. Do you have any suggestion for actionable items to help reduce bureaucracy in medicine?
Just take control again. I think that Kurt Eichenwald was excellent when he just said that doctors need to have guts. We need to just take back medicine. We need to be saying, listen, we're the ones that went to medical school. We know what patients need. You need to get off our backs and let us take care of patients. And the more we do that, the more we see how the bureaucrats are working more for themselves than for patients, then we can have the moral high ground and get things done. So in a sense, we just need to speak out. Now I realize that the moneyed interests are who we're fighting, and it's subtle. You don't really know. I just wrote an op-ed recently about is organized crime taking over medicine. And when you really analyze it, when you know the tenets of organized crime, which is where there's somebody in the middle that is silently siphoning off money, making everything more expensive. When that happens, that's what we're dealing with. It's organized crime. It makes everything cost more, and you reduce quality, and you reduce access. So we need to speak out on those things. And the other thing is the idea of the free clinics. I think when that happens, I think you'll hear more about it. And, fight against the MOC, just say no. I would say don't do it and see what happens, see what they say. They need doctors more than they need bureaucrats.
Have you been successful in rallying physicians in your community?
Yes, I have. Actually, when I ran for Congress last year, a lot of them came behind me and just said, yes, we understand what you're saying, and we're definitely for this. As I talk about this idea of kind of revamping the way we take care of the poor, a lot of them have come and said, yes, we want to do that. And they're just growing in numbers. Reaching the medical students is key, and reaching the residents. They rotate through our free clinic. The medical schools actually complain that we're brainwashing them. We talk to the students. But wow, that's the kind of brainwashing they need. They need to learn that, real charity is a solution, not the big government bureaucracy. So one at a time, you just keep on, you just reach out and you change the way people think.
So Alieta, Dan Craviotto here. Thank you so much for your leadership, your presentation, and for being on with us today.
Yeah, thanks.
So, yeah, you're welcome. So, I was drawn by that statement by Kurt Eichenwald that said, physicians are cowards and medical organizations have no guts. And it's frustrating when you're trying to speak out, but why do you think it is that physicians on the one hand will tell you to your face, you or any of us, yeah, you're right. Yeah, I believe in that. But then there's a disconnect between saying it and then being actively involved in engaging and doing something about it. What is it about physicians that there's that disconnect?
I think it's got to do with the training we went through. We kind of got accustomed to being abused, basically. Do you remember those attendings that just yelled at you and gave you such a hard time after you were up 36 hours? And you just kind of lived through it, and you just gritted your teeth and suffered, and you just did it. And you figure, well, it's going to get better at the end of this. But then you went through your residency, and it was the same thing. And you get into private practice, and then there's these HMO bureaucrats that are doing the same thing, and you're kind of accustomed to it. And you think, well, it's for the greater good. I really do want to care for patients, so I'll just put up with this abuse. I honestly think that's part of it. We're conditioned as we get trained. The other thing is, when you look at these groups like the ABIM and some of these medical societies that are making a lot of money on not caring for patients, such as we've got the AMAs making all its money by their coding system and having a monopoly on that. And then you see how the ABIM has just kind of made money, and they have to convince doctors to lie that their MOC is the only thing that's going to make you a good doctor. So those are the moneyed interests are the ones that we have to fight against. Here I am with charity. There's no money in charity. However, just looking in the eyes of patients who are so incredibly grateful because they know that you're doing it for free is priceless. And the more doctors get back to that, the more we're going to love our practicing medicine again.
Alieta, as former AAPS president, Association of American Physicians and Surgeons, and still an active member, as I understand, do you want to address anything about that organization and what your current activities are? I know you do have some interesting legal battles going on.
Yeah, Andy Slafley is our lawyer, and he has actually initiated a lawsuit against the American Board of Medical Specialties. It's very slow going. They have 8 lawyers that are fighting him. But you know something, when the truth is on your side, you just bide your time and let them call for discovery, and then we can call back and we'll find out more, such as what was uncovered about the ABIM. And I think that the emperor's new clothes are going to become obvious. So that's the one thing that the AAPS is doing. And we just continue to educate. We have students coming. We're having our annual meeting in St. Louis, October 1 to 3. Fascinating speakers where we just all come together. And it's like you get to recharge your batteries. You know, you're out in the real world kind of suffering under the current system, but then you get to find that there's doctors who think like we do, and it's a growing number. We have student scholarships to go to that, so if any student is interested, just let us know, aapsonline.org, and we can just get you in and get those. That's when I became kind of indoctrinated into freedom, was when I was a resident, and it's key to do it early.
Alieta, as you know, the AMA has about 15% perhaps of American physicians now as members, much less than its heyday of 75%. There are many great organizations like the AAPS, but again, no one has that majority membership or voice of overall American physicians anymore. Is there any possibility of creating a coalition of different groups that might achieve that majority voice again?
I mean, that would be wonderful if we could all speak in one voice. We did have a kind of a coalition meeting down in Washington, D.C. to craft a document of what real healthcare reform would look like. And I think we did a good job. But yeah, you do have all the different organizations. I'm not sure exactly what we need to do to get us to speak in one voice, but I think that there's enough of us who kind of are already doing it, and maybe cross-pollinate and just learn from each other. And I mean, this summit is a great idea. The videos need to just go out and get circulated, and more people just need to see that there is a better way.
So, Alieta, we're winding down. I do want to say that I've been observing or trying to observe. I've asked myself the question, what's the difference between physicians who take action and those who don't? And I think that the difference that I can see is that those who've taken action armed themselves with accurate information, knowledge. Knowledge is power. That's allowed these people to speak up with confidence, have their voices be heard, and have their, whatever their particular objective was, move forward. So thank you for the work that you have done in educating all of us. Thank you for joining us this afternoon. And we are
thank you for having me.
Always, Alieta. Thanks again.
Yes, thank you very much.
We'll see you
Alieta.
again soon.
Thank
okay.
you.
Thanks. Bye.
Bye.